So hello everyone, I am Jankin Enriquez, your student nurse from Davao Doctors College. And today I will be showing to you my written demonstration about parenteral medication. So this demonstration is a medication that enters the body by injection through the tissue and circulatory system. So there are three parenteral routes: the intramuscular, the intradermal, and the subcutaneous. So first is we'll check the doctor's order and the medication administration record. So the rationale for this is that the chart of the patient is more reliable than the medication ticket. So now we'll check it here. And then next is check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. So again, we'll now check the label. Next is follow the three checks for administering medications. Read the label on the medication when it is taken from the medication, before withdrawing the medication, and after withdrawing the medication. Then next is we will organize all the equipments needed. So this is to save time and effort. So here are the equipments that we will be needing. So we will start from preparing medications from ampules. So an ampule is a glass container designed to hold a single dose of a drug. It must be broken at constricted neck to access medication. So first is we'll perform hand hygiene and observe other appropriate infection prevention procedures. So this is to prevent the spread of microorganisms. Next is prepare the medication ampule for drug withdrawal. So flex the upper stem of the ampule several times with a fingernail. This will bring all the medication down to the main portion of the ampule. Like this. We will flick it. Then, uses an ampule opener or place a piece of sterile gauze or alcohol wipe between your thumb and the ampule neck or around the ampule neck. And break off the top by bending it toward you to ensure the ampule is broken away from yourself and away from others. Then, we will just imagine that this is the sterile gauze. So the sterile gauze protect the fingers from the broken glass, and any glass fragments will spray away from the nurse. Place antiseptic wipe packet over the top of the ampule before breaking the top. So this method ensures that all glass fragments fall into the pocket and reduce the risk of cuts. Then dispose the top of the ampule in the sharps container. We will withdraw the medication. Place the ampule on a flat surface. Attach the filter needle or straw to the syringe. The filter needle prevents glass particles from being drawn with the medication. So we don't have filter needle right now. So we will just imagine that we have a filter needle. Then remove the cap from the filter needle and insert the needle into the center of the ampule. Do not touch the rim of the ampule with a needle tip or shaft. This will keep the needle sterile. Then after that, with a single dose ampule, hold the ampule slightly on its side if necessary to obtain more than the ordered amount of medication. So dispose of the filter needle by placing in sharps container. If giving an injection, replace the filter needle with a regular needle. Tighten the cap at the hub of the needle and push solution into the needle to the prescribed amount. And also, if it has bubbles, we can flick the syringe. Then cap. So next is we will do the intradermal injection. So this is for us to know if you have any allergies or to test for your sensitivity. So we will do the same procedure like introducing ourselves to the client, verifying the name of the client, and explain the procedure to the client, then etc. Explain Next is we will explain to the client that the medication will produce a small wheel sometimes called a bleb. So a wheal is a small raised area like a blister. The client will feel a slight prick as the needle enters the skin. So ma'am, today I will be doing intradermal injection. So this is for us to know if you have any allergies or also to test for your sensitivity. So this may hurt a little, ma'am. So I want you not to move while I am injecting. So is it okay for you, ma'am? Okay, thank you, ma'am. Do you have any concerns, ma'am, before we start? So okay. The next is will provide privacy to the client. So the rationale for this is that for the patient to be comfortable. Next is select and cleanse the site. So our site will be at the forearm, about a hand's width above the wrist, and 3 or 4 finger widths below the antecubital space. Then avoid using the sites that are tender, inflamed, or swollen, and those that have lesions. Next is to apply gloves to avoid the transfer of microorganisms. So after applying gloves, cleanse the skin at the site using a firm circular motion. So we will start from center to outward. So we'll start from center to outward. So next is we will allow the area to dry thoroughly before the injection. So next is prepare the syringe for the injection. So here we use the tuberculin syringe. Next is prepare the syringe for the injection. Remove the needle cap while waiting for the antiseptic to dry. Expel any air bubbles from the syringe. Small bubbles that adhere to the plunger are of no consequence. So small amount of air will not harm the tissue. So to expel the air, we'll just do like this. Next is we'll grasp the syringe in your dominant hand close to the hub, holding it between the thumb and forefinger. Hold the needle almost parallel to the skin surface with the bevel of the needle up. The possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. Next is, after removing it, we'll inject the fluid with the non-dominant hand. Pull the skin at the site, this, until it is taut. So, for example, if using the ventral forearm, grasp the client's dorsal forearm and gently pull it to tighten the ventral skin. So, taut skin allows for easier entry of the needle and less discomfort of the client. So, after that, we'll insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. So, stabilize the syringe and the needle. Inject the medication carefully and slowly so that it produces a small wheal on the skin. So this verifies that the medication entered the dermis. So like this. And then withdraw the needle quickly at the same angle at which it was inserted. So activate the needle safety device. So apply bandage if indicated. So do not massage the area. Massage can disperse the medication through the needle insertion site. Remove and discard gloves for proper disposal and perform hand hygiene. So this is to prevent the spread of microorganisms. Next is we will circle the injection site with ink to observe for redness or duration per agency policy. So, document all relevant information, records the testing material given, the time, dosage, and the route. And evaluates the condition of the site 30 minutes depending on the test. Measures the area of redness and in duration in millimeters at the largest diameter and document findings. Some medication used in testing may cause allergic reaction, so epinephrine may be used. Document if the client had a positive or negative skin test result. Follow agency protocol on labeling of allergies. So next is we'll move on to the subcutaneous injection. So it is injected just beneath the skin. So example of these are vaccines, insulin, and heparin. The purpose of this is to provide medication that the client requires. So the gauge is between 25 to 27. Then the angle must be 45 to 90 degree angle. So again, we will do the same procedure. We will select and clean the site. Select a site free of tenderness and hardness. Apply clean gloves. Clean the site with an antiseptic swab and allow the area to dry thoroughly. So we will inject at the arm of the patient. Then prepare the syringe for injection. Next is inject the medication. Grasp the syringe in your dominant hand by holding it between your thumb and fingers with palm facing to the side or upward for a 45 degree angle insertion with the palm downward for a 90 degree angle insertion. Then prepare to inject. Using the non-dominant hand, pinch or spread the skin at the site and insert the needle using the dominant hand and a firm steady push. Then, when the needle is inserted, move your non-dominant hand to the end of the plunger. Some nurses find it easier to move the non-dominant hand. Then, withdraw the needle and discard. So if bleeding occurs, apply pressure to the site with dry, sterile gauze until it stops. But bleeding rarely occurs during subcutaneous injection. Dispose of supplies appropriately, so proper disposal protects the nurse and others from injury and contamination. Assist the patient into a comfortable position. Flip down medication ticket if not using MAR. Okay. Then do aftercare, remove the gloves, dispose used items in appropriate waste receptacle, return other equipment to its proper place, especially the MAR machine, then performs hand hygiene to prevent the spread of microorganisms. Assess the effectiveness of the medication at the time it is expected to act, then document all the relevant information, so for database. Next is, we will move on to the intramuscular injection. So this is to provide medication that a client requires. So the sites are the deltoid, the vastus lateralis, the ventrigluteal, and the dorsogluteal. So we will do the same procedure again. Explain the purpose of the medication and how it will help using language that the client can understand. Include relevant information about effects of the medication. Select, locate, and cleanse the site. So we'll select a site free of skin, lesions, tenderness, swelling. If injections are to be frequent, alternate sites. Avoid using same site twice for the injection. Then, apply clean gloves. Clean the site with an antiseptic swab. Prepare the syringe for injection. So we will here clean the site. Then, prepare the syringe for injection. Remove the needle cover and discard without contaminating the needle. If using a pre-filled unit, dose medication, take caution to avoid dripping medication on the needle prior to injection. If this does occur, wipe the medication off the needle with a sterile gauze. Then, medication left on the needle can cause pain. Inject the medication using the Z-track technique. Uses the ulnar side of the non-dominant hand to pull the skin, like this, pull the skin, and approximately 2.5 cm or 1 inch to the side. Then, under some circumstances, such as for an emaciated client or an infant, the muscle may be pinched. Pulling the skin and subcutaneous tissue or pinching the muscle makes it firmer and facilitates needle insertion. Holding the syringe between the thumb and forefinger as if holding a pen. Pierce the skin skin quickly and smoothly at a 90-degree angle. Hold the barrel and pull back using the dominant hand and aspirate for 5 to 10 seconds. Then remove. Then if the needle is in the small blood vessel, it takes time for the blood to appear. If blood appears in the syringe, withdraw the needle and discard the syringe. Then, if blood does not appear, inject the medication steadily and slowly, approximately 10 seconds per ml. Then, while holding the syringe steady, if using the ventrogluteal site, after injection, wait 10 seconds if using the ventrogluteal site. So, injecting the medication slowly promotes comfort and allows time for tissue to expand and begin absorption of medication. Then, after withdrawing the needle, we will withdraw it smoothly at the same angle of insertion. This minimizes tissue injury. Then, apply gentle pressure at the site with a dry sponge. So, we may use dry sponge because alcohol swab may cause pain. It is not necessary to massage the area at the site of injection. Massaging the site may cause leakage of medication and irritation. Then, if bleeding occurs, apply pressure with a dry sterile gauze until it stops. Then, activate the needle safety device, remove and discard gloves, document all relevant information, and assess the effectiveness of the medication.